our hookup, our health hookup, Lance Stormy. I like to refer him as the health hookup. You got the hookup, Dave? Well, yes, as a matter of fact, on our own, without any adult supervision, who knows what might happen.
Hey, we got Ty in this morning from Memorial Hospital. Hi, Ty. Tell us who you brought in here.
Yeah, so I brought Dr. Kakkar, and we're going to be talking about men's health. This morning it's Men's Health Month.
Men's Health Week, yeah.
So he's got some really interesting points, and really excited to have him on here.
Doctor, good morning.
Good to see you, Doctor. Thanks for coming in.
Men's health. Gosh, there are so many ways and so many areas where you can start. I guess the one thing is...
Let's start with Lance. And Lance's...
I knew you were going to say that.
And I'll start with Lance and Lance's approach to medical issues.
Okay, yeah, go ahead.
It's the chicken dance. Because...
I came in this morning and it said, men's health, and it said the number one thing that you need to get men is a physical. And we can start right there because not enough men are getting in to get physicals, right?
Sure.
Yearly physicals, yeah.
Absolutely. Thank you guys for having me again. It's good to be back on radio again.
Yeah.
There's several things I wanted to talk about today, and I know we don't have too much time, but I still would like to touch on some salient points.
Yeah.
The physical, of course, is very, very important, but one thing I wanted to talk about today was the barriers to men seeking health, and that's really, really important because part of the reason why men will go or will not go to get physical checks are these barriers. And there's a recent study that was done not too long ago by the American Academy of Family Physicians, which talks about the barriers. And three of the things that came up that I really wanted to talk about. One was men said, "I'm afraid to find something's wrong with me."
I believe we just played the chicken song. And that's exactly what that's all about, Doctor. I don't want to deal with the bad news.
I know. People just, are afraid, and I completely understand. There's a large population that also believes I'm very healthy and I don't need a doctor. I just don't need a doctor. Which brings me to my next point is, agreed, you might be very healthy, but part of the reason why you go for a physical is preventive medicine, is preventive care. Starting at the age of 35, you should go at least every 2 years to go see your doctor, get a cholesterol check. There's cancer screenings as well. Starting age 50, you want to get a colon cancer screen. Starting age 55 to age 69, you want to get prostate cancer screen. And then if you're a smoker, you want to make sure you get your lung cancer screen, and then talk about aneurysm screens as well.
Let me just touch base with Lance real quick. You're 51 now, right? And so
Did you get your colonoscopy?
No. Did you get your prostate? No. So you're speaking to your target audience here. You really are.
Yes.
So
yes.
Because he's relatively healtly as well. So.
Yeah. I'm in no way am I saying that I don't need a doctor. At 51, I do a lot. And I feel very healthy. I feel like I was when I was 25.
That's awesome.
But there are those benchmarks that drive me crazy that I wish I knew. I've had my shoulder dislocated now 4 times skiing, but when I was in the hospital recently, I said, as they were taking the blood from me because they have to give me, the things to put me under, I said, can you check my cholesterol?
That's part of it too, isn't it, Doctor? Getting baseline numbers.
So baseline numbers are important.
That's right. Yeah.
Absolutely. And, I always joke with patients. I say, your body's very forgiving when you're 20. It becomes less forgiving with each decade.
Yeah. I'll tell you this, it's downright hostile at 60.
So you want to, even if it's for basic preventive care, which I really think we don't emphasize enough, as physicians. And I think part of it is patients just don't realize, preventive medicine is important. You're trying to prevent a lot of the future problems. You're talking about diet. You're talking about exercise. You're talking about your basic screenings. And I think all those are really, really important.
I couldn't agree with you more. I can't disagree with you.
Intellectually, you cannot.
No.
Emotionally,
No.
you may not. And that's the bridge that has to be crossed.
Absolutely.
You make good at it. It makes total sense. And yet, I'm still
Absolutely.
not comfortable doing it. So, do you have a pill that I could knock him out and drag him into you?
No. Actually, that you just bring up a great point. One of the things that they found in the survey is your relationship with your doctor. And a lot of times, people will go to their doctor because their wife, men will go because their wife says, well, you got to go to the doctor. Or somebody says, well, you should really get this, and they'll go. But they really don't have a great relationship with their doctor. I think that's very, very important. You need to have, just like any other relationship, a good relationship. If you have a good relationship with your doctor, you understand them, they understand you, you are going to go to your doctor. You are going to be more likely to follow through with your health. So I think that part of it is important. So, if you can, find a good doctor.
Dr. Kakkar here. Look at him. He's in shape. He's friendly. He knows all of his stuff. This is the kind of a guy you want for a doctor right here because he would inspire confidence.
Okay.
Leave it hard, doctor.
No, he's good. You look great. You look wonderful, and I'm glad you're doing well. You really don't look like you're 51, so that's a good.
Did you hear that? Everybody hear that one?
Yeah.
You're breaking up.
I think my biggest concern at my point, because I do so much physical activity,
Yes.
and on the weekends I do a lot of hiking.
Yes.
And while I'm hiking, I'm always thinking that I'm going to have a heart attack or something.
Oh.
I don't know why. I mean, and it's probably because I haven't got in to have one of you doctors tell me that I got a heart of an 18-year-old to make me feel good. Well, so I need that checkup. Man, oh man.
Well, see, that's the problem because wives tell us to go to the hospital.
Yeah.
Yours tells you to take a hike. And so,
Oh man.
all right. So to put a bow on this, then, Ty, what we want people to do. This is really boilerplate common sense kind of
really
stuff,
is.
but that has tremendous. It isn't boilerplate outcome. This sets a baseline for your future health. This gives you the confidence and reassurance like that Lance would have that he could go hike, kind of gives you that base of what I can reasonably expect. And then there's also hidden stuff that might just pop up that you wouldn't know until you got to check out. So there's so many good reasons to do this.
Right.
We're recommending what? Get to your docs. You got info on website of a checklist?
Yeah, well, first of all, if you haven't signed yourself up for an annual checkup, I'd do that, Lance, and or anyone who's listening, with your primary care physician. And then also, there's a lot of resources we have at yakmemorial.org, including if you go to our classes and events page, you can see on our community education board there's a lot of resources at no cost to the public. So we definitely provide resources for everybody.
Bottom line,
not just
take
men.
some action. Talk is cheap. We know what you need to do.
Absolutely.
Now we just need to get out there and do it.
Yeah, that's right.
Consider
Thank you,
that your
gentlemen.
next hill
Thank
to
you.
climb.
Thank you
Lance.
very much.
That's right,
Thanks,
man,
Dr.
it is.
Ty. Thank you so much.